Hi, welcome to Facebook Live. I'm Dr. Annette Mercatante from the Clair County Health Department, and I'm all you have today. I'm doing a solo, so let's get right to the data and then to your questions. So our data today shows about 6.1 new cases on average over the last 7 days, so 6 cases per day, which is a slight increase from what we were seeing in the last several weeks. We're also seeing a 2% positivity rate in our testing, which is also a slight increase. The other big thing that happened with our data is if you follow the MyStart data database, or the dashboard that the state puts out, you'll see that our region, which we're connected to the Detroit region, and the Saginaw region have both been increased to high-risk areas, and that's because there have consistently been more than 40 cases per million, and we are now technically 42 cases per million as well ourselves over the last couple of weeks, and their test positivity rate is over 4%. So that means we are surrounded by communities that have much higher transmission rates than we do. So we're still doing pretty well, but we are starting to see a slight increase in the other direction, and we have to understand that some of our neighbors are really struggling to keep those numbers down. You can see the change in our graph. As you can see, after the second peak, we came down, we were going down, and now there's a slight upward trend of our data. And it is a little too soon to say if this is a normalization where we're going to stabilize at a new level or if we're going to continue to go up. This seesawing effect of our cases is probably what we're going to continue to have to deal with, the up and down. When we pull back and we do less, we see less cases, and when we go out and do more, we see more cases. And it's just going to be the nature of our condition. Next, we have the COVID percent positivity testing, and again, fairly good stability. This graph does in fact show on the blue bars the amount of daily testing that we're doing on average, and you can see there's been a slight fall down from that. Hopefully we'll come back up, but testing continues to be somewhat problematic. Resources are not always constantly available. There's some delays in testing, and this month in particular we went out into the community and did some community-based testing, but actually we did a fair amount of testing, so I'm not sure that it's us changing our location, but we'll keep an eye on that. Overall, since the onset of our testing, we continue to get about a 5% positivity rate. And finally, don't forget to take a look at our dashboards to see up-to-date cumulative numbers. And cumulative numbers are sometimes pretty impactful when you realize just the number of people that have had this disease. A small proportion, however, of the total population. That can be a good and bad thing. In my mind, it means we have a lot further to go. We can't even hope to reach herd immunity or see some kind of stabilization until a much larger portion of our population has been infected or has been vaccinated. We're still talking about, at the very most, 5% of our population that's had an infection here in St. Clair County. So we have to deal with this for quite a long time. But I'm not trying to be negative. Let's get to your questions.
Let's do question number 1 on your paper, because that came in last night.
Okay, so question number 1 is, how are the positive people reported as recovered? Do the physicians report it, patients themselves, or do you keep in contact with them until they have no symptoms? The answer is, if you have a positive COVID test, you are contacted by us, by the St. Clair County Health Department, and we monitor you until we feel that you have in fact recovered. We use clinical criteria to identify that, which means it's been at least 10 days since you became sick or tested positive, that you have no further fever for at least 24 hours without taking any medications to reduce your fever, and that overall your symptoms are improved. Your coughing is better, your headaches are gone, your vomiting, diarrhea, etc. are improved. So those clinical criteria can take longer than 10 days. We've seen some people who take quite a bit longer than that, but the soonest you'll be released from isolation is that 10 days. So your doctor may advise you, but generally if you have a positive COVID test, you will be hearing from us and we will be managing that. Officially, When we talk about recovered cases, it is what we put into the state surveillance system as recovered. So we take you out of the active case category and we move you into the recovered after we've directly interviewed you. So that's how that works.
Okay, so we'll go to the first question on the live feed. What does the CDC change in testing guidelines mean?
So the CDC has come out with some adjustments to their testing guidelines. The one that's most impactful is they no longer automatically recommend testing after an exposure to a COVID case. And that is quite honestly not that different from what we're already advising. Let's face it, if you find out today that you were exposed to somebody yesterday and you run off and get tested today, that test quite honestly is not very meaningful. It's not likely that you would show positivity that quickly. The sweet spot's a little bit more like 6 or 7 days. It can occur a little quicker, but it's probably not going to occur on day 1. And if you have an exposure that warrants a quarantine, meaning 14 days of you not going around other people, etc., a negative test does not mean you're not in quarantine either, because you can convert to a positive all the way up through the full quarantine period, which is 14 days. So really, the CDC guidelines allow for that adjustment. So in other words, instead of saying, oh, you've been exposed, go out and get a test, it allows for us to guide you on that testing mechanism, or your physicians to guide you on that mechanism. Now, if you're sick, you still need to be tested. Okay? And if you feel like you have a high-risk exposure and you're worried about going visit grandma, or somebody says you can't visit me without getting a test, those tests are still available to you. But what the CDC is really saying is allowing us to not automatically test people when we feel like the value to that test is very small.
Okay. Next question. This is in regard to schools. If and when there are outbreaks in our schools, how is it decided if just a class needs quarantining, or the whole school, or the whole region we're in back to phase 3? I'm hoping we don't have to close a whole school when a few have an outbreak.
Okay, so the question, they can hear you now, right? Because you're wearing a microphone. Hopefully you heard the question. In school, it's about what are our decision-making tools for closing or adjusting schools from in-person, where all the classrooms are there, to maybe reducing it, the size of the classrooms, to going ahead and closing the classrooms down, or even the whole school down, the whole building down. And really it depends on the data. So there's 2 sets of data we're going to be watching very closely. One is the community transmission. That's very important and very closely linked to what happens in the schools. So if a student or a staff member or a teacher is coming from a community that has high rates of transmission, that's automatically going to raise the bar and make us much more concerned about more cases coming in. The other piece of data we're going to be looking at is the amount of transmission within the school. So we have an isolated case in a classroom, and that classroom is already using strict risk reduction measures. Everyone's masked, everyone's far apart from each other, no one's congregating in multiple groups. We could probably safely just isolate that student, send them home, and just quarantine the students that were in fact within 6 feet of that individual longer than 15 minutes. Okay, if we're confident and comfortable with that. If we're not, perhaps the whole classroom would need to be quarantined. We're not going to start talking about closing schools or sending anyone home for a few days to 14 days until we can see that there's ongoing transmission within a classroom or within a school building. And that decision about ongoing transmission is really based on our investigations. Where was this person likely to have gotten infected? If they got infected from another place and not the school, you hold off a little bit more. So see, there's a lot of judgment involved with this. This discussion is being made right now very, very actively between all of the health officers and the health departments throughout the state, and having this conversation with state officials, and we're also having these conversations with your school. Rest assured that we are not anxious to close the schools down very quickly. We want to make sure that kids can stay in the classrooms as long as it's reasonably, the risk is reasonably low. But as soon as we start seeing a lot of transmission from student to student, it's quite clear we'll have to do something. And there's options. There could be putting more strict risk reductions in place, i.e. no one can be in the classroom without a mask, no one, etc., 6 feet, some of these things, or it might be sending everybody home for the 14 days. And I understand that's a little vague, but that's the way it's going to have to go. It's going to have to go situation to situation, and we'll learn as we go.
Okay, next question. I was told that 2 restaurants in Marine City had some cases reported. Is this true? If so, who are they? So today we sent out the media release on restaurants.
There are a lot of restaurants that have cases. Guess what? There's parties that have cases. There's all kinds of cases. And when we learn of a case, we generally investigate it first. We do need confirmation that the case is positive. And there's many times we hear about a case, social media is talking about a case, and there is in fact no positive test. We still have that conversation. We ask the people to self-isolate, whatever, if they're sick. But that's the first step. Now, if it is a confirmed test, we identify that, we talk to that individual, we talk to the business that the person, if they were working, we find out what the situation is when that infectious period began, which is 48 hours before the onset of symptoms, which makes it a little tricky. And we find out if they worked those days, if they did work, were they in contact with the public, and if they were in contact with the public, that's when the press release goes out. So if the public needs to know that there was a potential exposure to them just going into a public space, that's when we put the press release out. Sometimes through that investigation, that public exposure did not occur. It just occurred within perhaps the employees themselves, situations where it can be managed internally by just those people being notified. If we can notify people directly, that's how we're going to do it. We don't need a press release to tell the whole public. And remember, once a restaurant has a case, if there's any time that they're going to do everything right, it's after they've been scared with this. So we always check and make sure the cleaning process is okay. We always go through the spacing and the recommendations to reduce the risk. And I'll be honest with you, our restaurants are doing a really great job. Just because they have a case does not mean they're doing things wrong. But you also don't have to be worried about going to a restaurant after something like this, because if anything is going to make them do an even better job, that it's going to be a case within their ranks. So that's how we manage restaurant outbreaks.
And if they can notify the patrons of the restaurant, we don't need to put a media release out.
That's cool. That's true. If we don't feel, as long as we feel that everybody who is at risk for exposure has been notified, that's all we need to do. You know, we don't need to worry about somebody walking into the restaurant 4 days later after the person has been long gone. So that's how we manage it. And outbreaks, by the way, can also be found on the MDHHS website, their COVID website. I just noticed they're posting those. So if you're really curious about outbreaks and where they are, you can find them all there.
Okay, next question. I heard that people over 65 should wait until later in September to get their flu vaccine. Is that true?
So the MMW, or the vaccine recommendations, did just come out, and we are particularly concerned this year about dealing with the flu at the same time we're dealing with COVID, right? So more than ever, we want that flu vaccine to have the maximal impact it can. And there's always been some discussion about the elderly and the immune-compromised individuals, that the immunity from the vaccine doesn't last through the entire flu season. Now, young people, young adults, healthy people generally don't have that problem, but older people, there is some research that would indicate that the immune status may not last all the way through April. And so the sweet spot is to get the vaccine in September, by the end of October, because some of our earliest flu seasons start in October. So we want to make sure people have that protection before flu season starts. We don't know when that's going to be. Sometimes flu season doesn't start until January or February. But if it does start in October, if you've had your vaccine at least 2 weeks prior, you have that protection. So that's the sweet spot. That's where we want most people to get in. Now, if you get it a little later, it's okay. If you've got it a little sooner, it's okay. The most important thing is to get your flu shot.
So that kind of goes into the next question. When will we have the flu vaccine available?
Okay, flu vaccine is already available at your pharmacies. Health department, we're almost ready. We have not gotten all of our allotment in. We're waiting to get all of our formulations in, all the different kinds we need. Your doctor may or may not have the flu shot. It kind of depends on who they ordered it from, when they ordered it, what kind they ordered. But I would say very soon. Typically by the end of August, early September, flu vaccine is available. So you can start asking now. And of course, the whole issue of getting your flu vaccine too early is a moot point, because it's the end of August, people. So go ahead and get your flu shot if it's available.
And we will post information when we have it.
Yes.
We will have no walk-ins this year, however. It'll be all by appointment so far.
Okay. Next question. Why are there no biohazards that spread through the blood? And so if you have a procedure that bloodies a bunch of material, swabs, etc., that blood can still contain the germs that can spread infection. So it is required by law to put bloodborne pathogen stained bloody things, including needles, etc., into special biohazard containers that they are disposed of safely, so someone doesn't inadvertently go in and squeeze it and cut their hands, etc. So that's a regulatory need for bloodborne pathogens. It costs lots of money, and as you know, not everybody has biohazard waste receptacles in their homes. Now, viruses can spread a lot of ways, but this virus, influenza virus, RSV virus, pertussis, they all spread by respiratory. And if you blow into a cloth, a hanky, or a Kleenex, and you throw it into the garbage, yes, that virus could remain viable in that garbage can a little bit, but it's not going anywhere. No one's going to get infected by dumping that garbage can out. It doesn't re-aerosolize by doing that. Now, if you're going to go in and touch something in that garbage can, I'd wash my hands, I'd be careful, but it's not the same level of risk because the virus doesn't spread in that way. If you had a really bloody rag with a bunch of bloodborne pathogen and you touch that, there could be a problem if you had a cut on your hand. So it really is about how the virus is transmitted and what the risk of that transmission is. There's also just this very practical implication that biohazard medical waste disposal is just not readily available for every single person who's blowing their nose. So I hope that makes some sense, but it is not a reflection on the importance or the virulence of this virus. It doesn't mean that this virus isn't important just because we don't have a special biohazard receptacle for it. Okay.
Okay, so 2 more flu questions.
Flu questions,
that
okay.
they must have just come on, and
all right.
So maybe you could just answer these quickly. Are you recommending that people who normally don't get the flu shot get one this year due to COVID? And the other one is, when will the health department have flu vaccine available, and what's the process going to be? Okay,
so I just mentioned the flu vaccine available. I would expect it any day. We will publicize that when our vaccine's available and what the process is for our flu clinics and how we're going to distribute flu. We're still working on that because, let's face it, all of my staff is really busy working on COVID. So we're working on that, but flu should be available soon. Now, the question is, if I don't normally get flu shots, should I this year? Heck yes, you should. My question to you would be, why don't you normally get the flu vaccine? But even if you don't, this would be a great year to start. It really would be. It's a safe vaccine. It definitely protects you from more serious forms of the virus or infection. It keeps people out of the hospital. It reduces the spread. It's a win-win, people. It's a win for all of us. And the more people that get vaccinated, the better it works. So this is one of those things, because the vaccines are not 100% effective. You're going to do yourself an advantage, but you protect everybody around you. So I really hope that people pitch in and are willing to kind of do this for the good of the whole, because a low flu season, a light flu season, is going to be a huge win for us. A heavy flu season is going to really challenge us a great deal if we in addition to the COVID. Okay, did I answer all the questions for that?
Yep.
Okay.
Okay, why don't we go to number 4 on your sheet?
Okay. Someone I was around tested positive for COVID-19. Why didn't I receive a call from the health department, and should I quarantine? Okay. So number 1, make sure the person really did test positive for COVID. We are seeing people say, oh, I tested positive for COVID, and they maybe got an antibody test, which is not a definitive diagnosis for COVID. So that has to be put out there, that COVID needs to be diagnosed appropriately, and not everybody understands what that is. That's okay. You're not doctors, but I understand. If when in doubt, give us a call or call your doctor back and try and get that clarified. Why didn't I receive a call from the health department? Well, there's 2 reasons for that, maybe even 3. 1, we might have messed up. It happens. 2 is that you were not named as a contact. So we can only notify the people that we've been told are contacts. So if that individual was a case and we talked to them, if they didn't tell us that you were the person they were around, there's no way of us knowing that. And the third thing is that this may be one of those situations that crosses county jurisdictions. Those tend to get messed up. I should say messed up a lot more, but you know, so maybe a different health department is responsible for doing that part of the contact investigation, or vice versa, and sometimes those things are taking longer for different health departments. St. Clair County is doing pretty well. We're generally notifying most of the COVID positive cases within 24 hours, and their contacts 48 to 72. But I got to be honest with you, when things get really busy, that doesn't always happen. So if you think, and this is the most important part of the question, should I quarantine? If you think you are in fact somebody who has had a high-risk exposure to a COVID positive person, and what's high-risk exposure? It means you've been with them for more than 15 minutes within 6 feet, and you're talking to each other, especially without masks. You're singing together, things that would really make it likely that you breathed in their air for longer than a few seconds. If you feel that you are in fact that kind of an exposure, then by all means self-quarantine. It doesn't take us to tell you what to do the right thing, right? So if you think you're a possible contact and you can pull back, if you can't not work, say, then you can be very careful at work, right? You can make sure you wear your mask all the time. You can be very conscientious about washing your hands and being around other people in your workplace for long periods of time. Also, you can be very conscientious about going around vulnerable people. So if you think there's an exposure and you're just kind of self-quarantining, sort of, maybe that's the time not to go visit grandma. Maybe that's not time to throw a bonfire party in your backyard. So things like that you can consider on your own. We greatly appreciate it, because you know what? There's no way we can contact every single contact of a case. There's no way. It takes you doing the right thing, and I would just say, when in doubt, be cautious, do the right, be more safe than not. It's pretty easy to just decide not to go out for a couple weeks. I know it's hard, but it doesn't have, you can do other things, do things remotely, blow off that party, back off having your own shindig, and just do that kind of stuff. 14 days goes by really fast. And if you get sick, by the way, get tested. That's the most important thing. So this whole CDC change, the bottom line is if you're feeling ill, get tested. That's the important part, so we don't miss important cases that might be subtle, and then we can get into drawing the perimeter about slowing the spread.
And if we do call you,
yeah.
Please.
Oh, and if we do call you, answer the phone, talk to us.
Or call us back.
Or call us back, because that's a problem too. And I think our data was it about 20% that we're not getting any response from?
14% are refusing to provide.
14%, which just doesn't sound a lot, but it's a lot when you think about 14% are absolutely refusing to provide us any information. So talk to us. You know, you don't have, and we're not gonna like send the police out for you. We're gonna tell you what we think best practice is. We're gonna advise you what we think is the best way of you approaching this. We can advise you on testing if you need it. We can guide you through this process. We can get you help. If you need help to stay in quarantine, we can support you to stay in your home and assist you with that. So it's worth talking to us. It's certainly not going to hurt, and it could make a huge difference to the people you live with and your colleagues. So.
And the number one important reason why to talk to us is what? So people know, is to reduce
the spread of the
spread.
Yeah, so that I'm assuming you guys understand that the reason we want to talk to you is that we can understand what the limits of the spread of this virus are. So if we can get, I talk about drawing that circle, a perimeter around that virus, if we can find all the people that have been recently exposed or infected with the virus, and we don't let those people, or those people don't let themselves go on and spread it to other people, tremendous reduction in spread of the virus. This is what the stay-home order did. This is what has happened all summer long. When we do less, we reduce the spread of the infection. And remember, the slower the spread of infection, the better we all do. Kids can stay in school. Our doctors can figure out what to do. If you do get infected, they can come up with treatments and medicines and hopefully a good vaccine. And it's just a win for everybody to keep this spread low.
Okay, next question.
Yeah.
What is the research about taking vitamin D to help prevent COVID?
I do not know. The question is, what about vitamin D? I've heard zinc, I've heard vitamin C, I've heard D. I don't know. I'll research that for you and get back to you.
Okay.
My guess is it's nothing dramatic, but we'll see.
Okay, another flu vaccine question. If somebody received their flu vaccine in March of 2020, when can they get it again?
If someone received their flu vaccine
In March of 2020, when can the next vaccine be given?
we generally use one flu vaccine per season, unless you're under the age of 8 and have never received a vaccine before, a flu vaccine, and then we provide 2 vaccines in that season, I believe 4 to 6 weeks apart. So we are not currently recommending a repeat vaccine. That is not what the guidance is right now. I'm not sure why you'd get a vaccine March 2020. That's pretty late in the season, but if that's what you do, remember that the vaccine comes out every year specifically designed to deal with the viruses that are circulating that year. So we have 3 new subtypes this year in the vaccine to kind of follow what the virus subtypes are that are circulating worldwide. So the vaccine for this season, which is 2021, okay, is not going to protect you against the following flu season in 21-22. So I'm not sure. So March 20th, first of all, there wasn't any flu vaccine in March 20. That would be this past March, right?
So they may have gotten a late vaccine.
If you got, so if you got a vaccine March 2020, it had to have been a vaccine from last season.
So they're asking, when can they get the new vaccine?
Oh, right now.
Okay.
I'm sorry.
So they don't have to wait 1 year.
You do not have to wait. I'm sorry. If it was a vaccine from the last season, you can get the new season's vaccine now. I apologize. I didn't understand that question.
Okay. The next question is, somebody has a new granddaughter and they've been trying to get the whooping cough vaccine for months. Will the health department be offering this soon?
Of course. We've always been able to offer pertussis vaccine. We've been maybe a little harder to get in touch with. For a little while, our regular services were curtailed, but we're all back. You can get your routine vaccines. Just give us a call. All of those vaccines are available.
Okay.
I was thinking March 2020 was like next year.
Oh.
Sorry.
I don't have any more questions, but one thing I was thinking of is, what advice could you give parents and caregivers about this new school year, as far as?
So the advice for the new school year. So if your kid's going back to school, we urge you to have them wear a mask, okay? Teach them how to wear a mask properly. Make sure that they're used to it. Make sure they can tolerate it. Get them used to the idea that it's not going to be school as normal. They're going to be staying in classrooms. They're not going to be able to hang out with their friends. So talk to your kids about the importance of staying within the groups that are assigned. The more they interact outside of those groups, the harder it's going to be to, we talked the first question about how are we going to deal with a positive case in the school. If the kids have only interacted within a small group, we only have to quarantine that small group. If they've been relating and playing and doing everything with all those other kids now are involved. So it's hard for kids not to hang out with their best friends because their best friend might be in a different group, right? Because the schools are assigning these groups. So talk to them about the importance of staying and following those rules, allowing to interact virtually. But remember, just because school's over doesn't mean that the whole process of staying separated has lost its importance. If your kid leaves the school and is in group A, and as soon as school's over, they go and they play with group B and C for 3 hours on the playground, we've kind of lost our control, right? We kind of, if you will, the whole purpose of keeping kids segregated in small groups has been lost. So more than anything, I would urge parents to really work with your kids. This is not going to be easy, but it sure beats them staying home all the time. So work with them to understand that this is temporary. It's something we're going to have to go through for a while, but not permanently, and it makes all the difference in the world to kind of do the right thing.
Okay, it's 4 o'clock.
It's 4 o'clock already.
Yes, so you can wrap it up and say
Well,
goodbye.
thank you for joining us again. Next week we'll have our guest speakers back, whoever that may be. I really appreciate the questions. I'll check on that vitamin D question. Keep sending us your questions. If I don't know, I will check on them for you. And it helps me understand what you guys need to know. So thanks so much. Keep up the good work.